after a week's break, a month's break due to Ramadan, and hopefully everyone enjoyed the time off as well with the weekend. So we will wait for 2 minutes maximum before we can start. We just will let everyone in now. And we have got a really exciting topic at hand today, and a really a subject that will help our community and then ensure that we have got our questions, etc., as well to ask our speaker. Keep everyone 2 minutes, and then. Everyone, to the latest edition of the Ellipsa webinar. So we've got a really interesting topic that we've got discussed here. So my name is Alok, and I welcome you to our April edition of the Ellipsa monthly webinar series. So just to give a quick recap, I know we've got lots of new attendees joining us today. So we were established in February 2023. So we're just over 3 years old. The idea behind Ellipsa is to support the aging lifestyle in Blacks and Asians, and have it as a knowledge exchange and research engagement program. So we have free monthly webinars such as this, which features GPs, public health specialists, etc., to support aging in our community. So this is our mission for Ellipsa. So we want to advance health equity by providing health information resources through webinars, but also outside it, improving health literacy through our programs. And we also want to support and improve community-based participatory research, again, to ensure that our voices are heard with research as well. Ellipsa has got 232 members, a WhatsApp group members across the globe. So if you are interested in joining Ellipsa WhatsApp group, again, we will get updates and invitations to various events, research, etc. Please join us. We will post a link to the WhatsApp group on the chat now. So we've got our community. We also have our website, so you can catch up on previous webinars, and also, again, keep up to date with what Ellipsa does. So please on Ellipsa at YouTube, but also our website and our Ellipsa WhatsApp community. So today we host. My name is Alok. I would be the co-host for today. I am the webinar lead at Ellipsa and CEO, and I have Martin will co-host this webinar with me.
Thank you, Alok, and welcome everyone. My name's Marcia May. I'm a senior lecturer in adult nursing at UE Bristol, UK, and part of the Ellipsa team. I have got a passion for health, and I'm part of the admin team. As you can see, that we are made up of a dedicated team and volunteers with various backgrounds, including researchers, practitioners from academia, health and social care sector, We also extend beyond the UK with volunteers serving as champions in regions, advocating for health literacy and supporting local community initiatives in their own countries. So before we dive into the main topic, I'd like to quickly just walk you through what we have planned for you for the next half hour. We've had a brief introduction by Alosh to the mission behind ELIPSA, and I've just introduced very briefly our team. Shortly, we are honoured to have our guest speaker, Dr. Hassan, and he'll lead our core discussion around your kidney health and what you need to know. Then we'll open the floor for a live question and answer session, and there'll be a chance to ask brief questions. We need to keep them brief so everyone has an opportunity to ask their questions and you have an opportunity to share your comments. And finally, we'll wrap up with some closing remarks and details of how you can stay involved with our future events. So just some housekeeping. During the presentation, please keep your microphones on mute, but please switch on your cameras. We'd love to see your beautiful faces from across the globe. And during the question and answers, please use your virtual hand if you've got a question, or you can enter the questions in the chat box as well. So we'll take questions right at the end. Before we start, we would be grateful if you can grab your phones or there'll be a link in the chat shortly. You don't need to do this now, but if you have it ready on your phones, we'd be grateful if you could help us just to complete a research survey, either using the QR code or the link in the chat box. And we'd love to hear your views about the use of digital apps and fitness tools that are created, which are there to increase your physical activity and to improve your health. You may not be using this at the moment, but we want to know, are you? If you're not, then what can be done to support you with using these? As I say, the link will be in the chat. So without further ado, it's my pleasure to introduce our guest speaker, Dr. Hassan, who is a consultant physician and nephrologist, and he will be delivering an informative presentation on kidney health and what you need to know. So thank you, Dr. Hassan, and we'll hand over to you.
Thank you very much, Marcia, for that brief introduction. Just a minute to share my screen.
And while we're waiting, the link is for the survey is in the chat. So please do just click on it so it's there waiting for you for after the presentation. You can complete that at the end.
Good evening, everyone. I'm sure you can see my slide now.
Yes, we can.
Oh, thanks. Yeah, good evening, everyone. My name is Modami Olamide Hassan. I'm a senior lecturer at Obafemi Awolowo University, Ile-Ife. I'm also a consultant nephrologist at Obafemi Awolowo Hospital Complex, Ile-Ife. First, I want to thank the organizer of this program for inviting me and for giving me opportunity to share my little knowledge with the community. Inshallah, this evening, I'm going to be discussing or presenting the presentation title, Are Your Kidney Healthy? And what you need to know. I have no conflict of interest to declare, and the next couple of slides will just to, for those that have been to Ife, that is the new look of Obafemi University entrance, and then next that is my That is the College of Red Sciences of Bafemi Awolowo University, Ile-Ife. And that's also the Quadrangle in the College of Red Sciences, Ile-Ife. Now to the business. I'm going to ask us, what are the kidneys? What are they? Do we even know what they are? I don't know if anybody want to give it a go. What are kidneys? Maybe we sample one or two, then we go on. Can you hear me?
Yep, we can hear you.
Yeah. Is there anybody that want to give it a go? What are kidneys?
Kidneys are organs that filter blood.
Yes. Any other one?
Remove toxins and etc. from our blood and our body.
That's great. You are doing well. Any other one? Let's just another one person, then we go on. I can't seem to hear that. Okay, without wasting our time, thank you everybody everyone that attempted that. Without wasting our time, kidney, like the heart and the lung, are among the most important organs of human body. But most people don't know very much about them, maybe because the work they are doing is they are smallish, and then the kind of work they are doing is not really known to anybody until they stop working. Moreover, in every person, there are two kidneys, and they are located on either side of the spine at the lowest level of the rib cage. Like one of our participants said, kidneys are a pair of bean-shaped organs. If you have ever seen a kidney bean, I'm sure the ladies in the house they are so familiar with kidney beans. So that is how the kidney looks like. Then you know what the kidney shape is like. Each kidney is about the size of your fist. Can everyone clench your fist? The size of the kidney is the size of your clenched fist. So if you are a well-built person, your kidney is likely going to be bigger than somebody that is of a smaller size. So your kidney is approximately the size of your clenched fist. Each kidney is about the size of your fist or the size of a cellular phone or a computer mouse. I'm sure all of us, even if we are not a medical student or a health practitioner, if not undertaking anatomy before, at least you know your mouth. The kidney is approximately the size of a mouse. In adult, a kidney is about 10 centimeters long and 6 centimeters in weight and 4 centimeters thick. And like I said, about the size of your fist. And it weighs approximately 150 to 170 grams. Somebody has already told us the functions of a kidney, so I won't be asking that question again. What are the functions of the kidney? The primary jobs of the kidney are to make urine and purify blood. The kidney removes waste material and extra salt and water from the body. The kidney has two main blood vessels, the artery and the vein, that is referred to as renal artery and renal vein. Renal artery is the one that takes the blood to be cleaned from the body into the kidney. Take blood from the body into the kidney, and then the renal vein returns the clean blood back to the rest of the body. There are thousands and thousands of tiny filters that is referred to as nephrons. Approximately in an individual, a normal adult, there are 1.2 million nephrons in both kidneys in an adult. These nephrons that will that we are going to be referring to as a filter. They filter blood and produce urine that collects in the drainage system of the kidney. This slide is showing us the collecting system of the body, the ureter, and then the bladder. After the kidney makes the urine, it drains down the ureter, which is the tube that passes from the kidney to the bladder. Urine collects in the urinary bladder, and when enough urine fills the bladder, the bladder is about 500 mils capacity. So when the urine fills the bladder, you get the urge to go to the toilet. As you empty your bladder, urine leaves the body through a tube called the ureter. What do kidney do? I'm going to ask that question again. What do they do? One, the first thing that the kidney do is the kidney purify blood by removing waste products produced by normal body function. That is, what the body doesn't need, the kidney remove it and excrete it outside the body. The food that we consume contain protein, fats, and carbohydrates, and many other things. These substances are necessary for the growth and repair of the body. However, some of these food cannot be used because they are waste, and when they are waste, they can be harmful to the body unless the body gets rid of them. The two kidneys do this work effectively. The kidney get rid of waste created from digestion of food and other chemical reaction in the body, like I said. I'm also going to inform us that for every minute, 1,200 ml of blood enter both kidney for purification. In other words, 1/5 or 20% of the total blood pump from the heart go to the kidney. So the renal blood flow, the blood flow that goes to the kidney, 25% of the cardiac output, that is when the heart pumps once, 20% of the blood that is pumped to the body goes to the kidney. And that is showing us that the kidney is a very important organ and very, very intelligent organ. So in one day, 1,700 liters of blood is purified by the kidney. In an adult has around 7 to 8 liters of blood, which is about 14 to 16 pints of blood. Each pint is about 500 ml. And this is constantly filtered by the kidney. And this is filtered as much as 400 times per day. I think we need to say Allah Akbar. This is really huge because this kidney, they work continuously to make sure that our body are fit and are rid of waste products. The other function of the kidney is they control fluid balance by eliminating extra amount of water that accumulates in your body, but keep the necessary amount of water in the body. So any excess fluid is excreted by the kidney. So that explains why on a hot day, when you are dehydrated or when you are fasting, you are likely going to pee less than a cooler day when you pee. The frequency of going to the toilet is more. So the kidney maintains exactly the right amount of water in the body. The other function of the kidney is that they control blood pressure. Okay, no, I think before we go to that, the kidney balance the minerals and the chemical in your body. Aside the water, the kidney regulates minerals and chemicals and maintain a normal composition of body fluid. This function is extremely important as it allows the body to work properly and be healthy. The other function of the kidney is to control the blood pressure, to make sure that the blood pressure is well controlled. Hormones are chemical substances that act like messenger in the body. They help control how cells and organs do their work. So the kidney produce some hormone. One of them is renin, which regulates the blood pressure and which cause blood pressure to rise as needed to make sure that the right amount of blood gets delivered to all parts of the body. So when the body fluid is reduced, the blood pressure will increase so that the kidney get enough blood that we refer to as the kidney is well perfused. And when the other way around, the blood pressure is reduced. That is done by the renin. The other function of the kidney is to produce another hormone that is referred to as erythropoietin. This erythropoietin tells the body when to make more blood when the blood cells in the body is low. Red blood cells in the body is low. The erythropoietin will command the body to produce more red blood cells. And that will explain why anemia, that is low blood in the body, is common in patients with a kidney disease, because the kidney, when they fail, they can no longer produce erythropoietin. The other function of the kidney is that it helps produce vitamin D. Vitamin D is a vitamin that is produced when you are exposed to sunlight by special cells in your skin. The kidney converts vitamin D from the food you eat into its active form. The kidney produces an hormone that we refer to as 1-alpha hydroxylase. And that will help convert the inactive vitamin D to active vitamin D that will allow enough calcium to be absorbed in the gastrointestinal tract when we eat. When the kidney is not functioning well, it's not able to produce this hormone, and then vitamin D is not produced, and the bones will not be healthy, and there will be a lot of pain. That explains why some kidney patients generally have weak bones and body pain. So these are summary of what the kidney do. They help make blood cells, remove waste products, control blood pressure, control bone metabolism, neutralize acid, and balance electrolytes. So kidneys are crucial organ in the body. Our life will be at risk when kidney function doesn't work properly. I would also like to inform us that our body can work normally with just a single kidney. That will explain why a kidney transplant patient will live a normal life with just one kidney. And if somebody loses one kidney, he can live well. That also explains a kidney donor, they live a good life. So what happens when both kidneys don't work well, or when they lost all their function? Yeah. When the kidney fails, there are consequences. Then there will be anemia because erythropoietin is not being produced again. Ms. Penta. So there is anemia because erythropoietin is not being produced. Patient has there is uremia, that is accumulation of uremic toxin. Patient has become hypertension. In fact, hypertension is one of the surrogate marker of CKD. When you see hypertension in a young adult, it's likely to be CKD or to prove it otherwise. Renal osteodystrophy, this is the bone mineral disease as a result of non-production of vitamin D. The bones are very weak and not healthy. There is accumulation of acid because the acids are not being regulated again. There is high potassium, which is dangerous to the heart because the kidney cannot regulate, cannot excrete potassium again. There is low calcium and there is high phosphorus. So, just need to talk about some statistics. The burden of kidney disease in America, 1 in 10 people are living with kidney disease. And of these 1 in 10 people, diabetes and high blood pressure are responsible for 2/3 of these cases. In addition, majority that have kidney disease, they are not even aware that they have kidney disease. 9 out of 10 adults with CKD do not know they have kidney disease. And even in addition, adults with severe CKD, 1 in 3 of them don't know they have it. And 40% of the people with severely reduced kidney function are not aware of having CKD. So CKD can be, somebody can have CKD and might not even be aware until towards the tail end. So that explains why patients present in advanced case. 360 people begin dialysis treatment for kidney failure every 24 hours. So this is a serious problem. In United Kingdom, in the Northern England, 1 in 20, I'm quoting this study. This study was done in Catholics, and 1 in 20 adults have CKD. And when we now look at people over 75 years, 1 in 3 of them have CKD, meaning that CKD, kidney disease, is associated with advance in age. Nationally, between 40,000 and 45,000 people die every year from CKD. And coming back home to Nigeria, this was the study that we carried out in our unit about 20 years ago. But I'm using the slide because it's still very relevant. You can see there is exponential increase in the prevalence of CKD from 1989, when our unit was established, to 2007, from 5% of our admission, CKD or CRF rose to 20, almost over 20% of our CRF admission and medical admission. Don't get it's not that at any time that there is that the prevalence we do. When the troughs that we are seeing, those are the years that there are strike. So patient will not come to the hospital. So what are the risk factors for kidney disease? The common risk factors are advanced age greater than 60, poorly controlled or high blood pressure, diabetes, long-standing diabetes or poorly controlled diabetes, people that have heart disease, patients that are obesity, smoking, family history of kidney disease. If one family member has kidney disease, there's likelihood that another family member will have kidney disease. And also, kidney disease is that also race and ethnicity is a risk factor. There is higher prevalence of CKD in people of Africa ancestry, and this is due to presence of ApoL1 gene polymorphism, which is common in people of West Africa ancestry. And other ethnicities that are also associated with CKD are Hispanic, and then the native Indians, and then the Asians. So Are you at risk of kidney disease? If you have all this, then you are at a risk of kidney disease. If you are a known diabetes, if you are a known if you are a known hypertensive that is poorly controlled, if you are obese, at times even referred to as morbidly obese, if there is a family history of kidney disease, if there is long-term use of over-the-counter medication, in other words, abuse of non-steroidal anti-inflammatory drugs like ibuprofen, the painkillers, diclofenac, niacin, Feldin. These are some of the drugs that is widely abused. They are risk of CKD. Age greater than 50, some will say 50, some will say 60. People that have heart disease. Interestingly now, acute kidney injury is not totally reversible. Current study has now shown that acute kidney injury, patients that have survived acute kidney are at risk of developing kidney disease later in life. And that is why patients that have acute kidney injury should be followed up for a long time, because they are at risk of developing chronic kidney disease later in life. So if you have any of these, please, you need to talk to your doctor to assess you. What are the symptoms of kidney disease? I will need volunteers. Let me see what we know about whether we know if somebody has kidney disease or not. What will you see? What are the signs that will make you think that somebody has kidney disease? Because if you're able to do that, we'll be able to protect ourselves. And we have 1 or 2 people volunteer.
Swollen ankles.
Swollen ankle, that's great. Any other one?
Swollen legs. Swollen legs.
Swollen legs, yeah. Ankle, legs, the same thing. Any other one?
Stomach pains.
Stomach pain, not too sure of that. There are GIT symptoms. There are symptoms in the GIT, but let me not
Swollen stomach.
Swollen stomach. Yes, they could have ascites, they could have swollen abdomen. So
Paleness.
Come again, please.
Paleness.
Paleness. So they are anemic. Yeah, you get it right. So anemia is one of the symptoms of CKD. They are likely going to present very. They won't tell you they have anemia, but they will have symptoms of anemia. Those are weakness, excessive weakness, and tiredness. So let's go on. So these are the symptoms of chronic kidney disease. Body swelling, that is referred to as edema. Fluid retention caused by the kidney inability to remove excess sodium and water. You remember we said the kidney remove excess sodium and water. So when the kidney fails, it can no longer do that. So this usually manifests as puffiness in the ankle, feet, or hand, and sometimes around the eye or in the face. Patients who have fatigue and weakness, and these are partly due to buildup of uremic toxin, the waste product, and the development of anemia, which is a common complication where the body lacks enough red blood cells because it can no longer produce erythropoietin. And this leads to persistent tiredness, no allergy, and which we refer to as anhedonia, and difficulty in concentrating. When they go to work or go to class, they cannot really concentrate because they are very tired. Patients who have dry and itchy skin, they could have skin issues. These are persistent dry and itchy skin, so they could have pruritus because these uremic toxins are also deposited under the skin and they start causing irritation of the skin. They could have muscle cramps. This as a result of frequent cramping, particularly in the leg due to imbalanced electrolyte like calcium, potassium, and phosphorus. And There was also increase in the urine frequency. So patient will be waking up more than 2 times in the night to urinate, and this is referred to as nocturia. When the patient it's normal to wake up 1 or 2. The moment is more than 2, that is abnormal, and that is referred to as nocturia, and that is one of the early signs of kidney disease. It's also suffice to say that patient may not, one of the early signs is inability to concentrate urine. But patient will not know to say, I'm not able to concentrate urine. They will be passing more urine as if they have diabetes, that they're having polyuria. So it's not that they have diabetes, it's because they cannot concentrate their urine, and they have what we refer to as polyuria frequency. So the other thing is change in the color of the urine. There could be blood, it could be reddish, it could be brownish if it is altered, so that could be hematuria. Also, the other thing is foaming of the urine, which occur as a result of leaking of protein in the urine. Protein should not come out in the urine. The normal level of protein should be about 150 milligrams in 24 hours. The moment you're having 200, 300, the urine will start foaming. So one of the signs of kidney disease is foaming of the urine. Well, early kidney disease are no signs or symptoms, because one can lose up to 90% of the kidney function without any sign, because the kidney is a very, very, very illustrious organ. When you lose some kidney function, the other remaining filter or nephron will try to take up the work, and then they also get consumed until no nephron remain. So that explains why you can lose up to 90% of your kidney function and you still be moving around. Until it's less than 10%, suddenly that patient will present in the hospital. And most times when they present at that stage, we can hardly do anything. They're likely going to go to dialysis, or they'll be requiring transplantation. So early detection can prevent the progression of the disease and avoid medical treatment. So early detection is highly important. So I will recommend, it is recommended that at least once in a year you carry out your kidney function, which we'll talk about in the next slide. So what are the tests that you can do to know that your blood urine, blood tests, to check your kidney function? Blood urine tests are the only blood and urine tests. So the blood will test for electrolyte and creatinine, while the urine will test for proteinuria. So you can do this once a year. It suffices. If you do it once a year, you'll be able to know what your kidney is. So when the kidney function less than 10%, that is referred to as end-stage renal disease or chronic renal failure. And when the kidney is not functioning again, then the patient needs dialysis or renal transplantation. Dialysis remove waste product and unwanted water, and then dialysis can be divided into hemodialysis and peritoneal dialysis. Hemodialysis uses a filtering machine to remove waste and extra fluid from blood, as if washing machine. While peritoneal dialysis uses the lining of the belly, which we refer to as peritoneum, to do the filter. The other one is the kidney transplantation, that you remove a kidney from a live donor or a deceased donor and give it to a recipient. I'm rounding up. Can kidney disease be prevented? Yes. How do we prevent this kidney? By keeping your kidney healthy. And what are those things that you need to do? There are 8 golden rules. What can you do for your kidney? There are several easy ways to keep your kidney healthy. The first one is physical exercise, practicing sports, going for walk, and especially aerobic exercise. So it is recommended that you exercise for at least 30 minutes 3 times a week. 30 minutes 3 times a week. You can do more than that, but the minimum is 30 minutes 3 times a week. Eating healthy food to ensure good nutrition and good control of your blood sugar. Eat healthy food that does not contain too much sugar. Too much is too much. And then eating fruit and vegetable will help your kidney too. Monitor your blood pressure. The normal your blood pressure, the target blood pressure, the blood pressure should not be more than 140 systolic and diastolic 90. When there is presence of kidney disease, the guidelines recommend that the systolic should be 130, one diastolic should be 80. The other way to protect our kidney is to eat healthy and keep your weight in check. Reduce your salt intake. Reduce your salt intake. Salt is also too much. It is eat freshly. Eating too much salt will result in high blood pressure. Eat freshly prepared food and try to limit the amount of processed or packaged food, because these food contain a lot of salt and a lot of refined sugar. Maintain a healthy fluid intake. It is always better to choose water over sugary drink or diet drink. And then how much of water should we take in 24 hours? Minimum of 3 liters in 24 hours. For people in Nigeria, we have water. Each sachet water is about 500 ml. So 3 liters will be 6 sachet water. If we are using 75 cl, that will be 4. The 75 cl. And if you are using 1.5, that would be 2 in a day. And the other way to know whether you are dehydrated, when you are not taking enough water, the moment your urine your urine should be clear like water. When your urine is now being amber, is becoming a kind of a straw color, then you know that you are not taking adequate water. Do not smoke. If you are smoking because, please stop it. It will cause atherosclerosis, which also eventually lead to renal artery stenosis, which will lead to CKD. Do not take over-the-counter pills on a regular basis and avoid herbal medication. I've talked about it, not steroid anti-inflammatory drug. There are a lot of herbal drinks in the market. It's like we are sitting on the gunpowder. Please, let's refrain from taking this drug. People that do menial job, they will say, when I get home, I'm going to take, in Nigerian parlance, we say akako. These are combination of non-steroidal anti-inflammatory drug. Please, let's desist from this. Don't take non-steroidal on your own, because this will eventually damage the kidney. Herbal medication, please refrain from it. And then also for the ladies, bleaching creams, let's refrain from it. These are cause of the kidney disease. So the last thing is, you ask your doctor to check your kidney if you have risk factor for kidney disease. If you are known hypertension, you are known hypertensive, you are known diabetic, you have family history of hypertension, or even that you are black, is a risk factor. Especially for all that are from West African sub-region, we should check our kidney regularly. I think this will be my last slide. Thank you for your attention.
Thank you so much for the presentation there, Dr. Hassan. That was really, really helpful, and it was very detailed as well. And what I really liked about the presentation was that it gave so many actual tips that we can use in real life. It's not like all theoretical, but it's like these are the things that we could do to ensure that we don't fall prey to the kidney disease. So that was an incredibly helpful presentation, and thank you so much for your time and effort to do that. We really appreciate that at Ellipse. So before we go into feedback, is it possible really quickly for everyone to turn on their cameras? We could just want to take a screenshot We had a major milestone today. I think we have 80 people today, so it's a tremendous achievement for ELIPSA. A quick screen grab, if you could all turn on your cameras, we'd really love to see your faces for that. And I'm sure that you would have that picture will be taken as well. Thank you very much for that. So before anything, we'll go into the feedback. I'll leave that in the capable hands of Marcia May.
Okay, thank you, Alosh, and thank you, Dr. Hassan, for a fantastic and informative presentation about how the kidney works, the risk factors, things we can do to reduce our risk, symptoms. It was really informative. Thank you. We've now got a quick Menti for you to complete. It's just 3 questions. So if you've got your phones available, this is something different to the survey. Your phone's available, or we've got the link in the chat. I can see some people are responding already, so thank you. So if you can let us know, how did you find today's webinar? So we need to know for feedback. It's good for Dr. Hassan, good for us at ELIPSA, to know what you thought of today's webinar. So if more people want to join, please do. We haven't got very long, so I don't know if everyone will join the feedback, but if you can, then please do. Okay, we have got some responses. I'm going to move on to the next slide. Is that okay with everyone? Alosh, should we move on? Because I don't think we've got too long, have we? I'll move on to the next slide, because I think this one is more important. So what one good practice are you going to take from today's webinar that you will implement? I know I need to drink water. Right. Anyone else want to join in? Could we just have the link again in the chat? Is that possible? Just in case anyone's missed the link. Actually,
I'll go into the next question.
Yeah, and the last one is, so this is more about us. So how can we make the ELIPSA webinars tailored to your health needs? So, you know, there could be things that you may be thinking, oh, I wish I knew more about this, or I wish I knew more about that. You may have friends or family, maybe with health condition or health needs. We want to know more. It could be about physical activity, how to access it.
Yeah, that's a very strong one.
I'm going to stop sharing, but I will leave that final one open. So if you want to continue, then putting out some feedback, then you can do. So thank you very much for that. That's really helpful for us and for Dr. Hassan as well. So thank you.
Thank you very much for that, Marcia. So we don't have much time, so we'll go straight into the questions. So we'll have Marcia and Dr. Adesope monitoring the inbox. So like we mentioned before, please put any of your questions in the chat box or raise your hands as well. So we'll monitor both of that for the speaker.
Yes.
Thank you very much, Dr. Hassan, for the wonderful presentation. We have Fauzia. Please ask your question, please.
Good evening, everyone. Good evening, the organizer. Doctor, thank you for the wonderful presentation. A quick one. How does the kidney stone affect the risk for kidney disease? Thank you.
Should we start answering?
Yes.
Should I start answering the question? Or we want to take everything?
We would have loved to take everything, but for now we have just that
Okay.
question for now. Please
Okay,
go ahead.
let's start answering. Thank you, ma, for that question. Kidney stone. Because it's just because this lecture is so concise. That's why I didn't talk about kidney stone. It's another rare. But going to your question, how does it affect the kidney function? One, the kidney stone is also hereditary. There are people that are high risk, that they have the genes of forming stone. That is one. And also what we eat, there is sugary and some the kind of food that we eat predisposes us to kidney stone. And the other thing is also dehydration. Animal fat is part of it. Dehydration, you are not taking enough water. So when we now have stone, two ways that is going to impact on the kidney function. The first one is it can block that drainage I talk about, the ureter. And then when it's blocked, it's just like there is a water in a reservoir. And when something blocks it, there will be building up of pressure. And then the urine will not be able to pass. And then the kidney will start ballooning out and then destroy the kidney. That's what we refer to as obstructive uropathy. Then also the stone, because the urine there will now be stagnation of urine, that we refer to as urine stasis. So the urine now cannot be passed out. The urine stay longer, and then there will be infection. So a repeated chronic infection will also further damage the kidney, and that is what we refer to as chronic pyelonephritis. These two ways, patients with stone and infection from stone could develop CKD and CRL. And again, apart from the chronic kidney disease, it could also have acute pain, and that's what will actually bring them to the hospital acute as emergency. But many a time they might not have that. The kidney will have been damaged before they present. So again, it's regular checkup. If a patient that have kidney disease, that have stone, may be having pain in the loin and or pain in the groin. So if you have that, please present to the doctor. Don't go to a pharmacy and they'll be giving you an analgesic that will further kill the kidney, worsen the kidney. I think I will stop there. I hope I've answered your question now.
Thank you. Yes, thank you very much, sir. Mr. Tunde Falola, please ask the question, and I would move to Matthew.
Good evening, Doctor. Thank you very much for the
Good evening, sir.
One presentation. Question is this: for how long can one hold urine inside him or her before going to the toilet? Take, for instance, you are traveling here in Nigeria here, and you are traveling from here to Ibadan or Bini, and while you are in the vehicle, you are pressed. You cannot ask the vehicle to stop. For how long or how many hours can one hold urine before to avoid damage to the kidney? And secondly, going by the fact of the case that is a big part of the body.
It's breaking. I can't hear that second question.
Is there, I mean, redeemed?
It's,
If
we
you
can't
understand
really
what I'm
hear
saying,
you.
sir.
It's the
I
line
can't
is
hear the second
breaking.
question.
Would you like to type the question,
What I'm
sir?
saying is that,
Yeah.
okay, I will do that.
Oh, thank you, sir. If it's clear, you
Okay,
can
answering
go
the
ahead.
okay, asking the first question, I think I had that. How long can one hold the urine? I will advise us not as soon as you can. I don't think there is a particular duration that I can recommend. I will advise that as soon as you're able to do it, please don't hold urine, because anytime you are holding urine, that's what we call reflux nephropathy. The urine will be returning back into the ureter and into the kidney, and that will cause infection. So it's not advisable to hold in urine. That will happen in patients that have prostate and they are holding the urine gets stagnated. So it's not good to hold urine. As soon as you can do it, please do it.
Yeah, thank you very
Thank
much
you.
for that. And we have Mr. Max to go next, but we
Okay.
have limited time. But we
Yes,
are running.
just a quick one.
Okay.
Thank you very much for the lecture. Now, you talked about medication. Nowadays, you see a lot of doctors online on social media, and they will tell you, take cloves, take this, take that. Now, you want against that. Please, I need you to emphasize on that. And again, you talked about analgesics, that we shouldn't be taking it. I mean, when you get to a certain age in life, the only thing you use to get yourself, because you have body pain, back pain, this pain, you take paracetamol. Are you saying we should reduce paracetamol? And the third one is just at what time do they give you medication? The doctor will recommend medication like atorvastatin. Do we take it or we go on water? Thank you.
Yes, please go ahead, sir. Dr. Hassan.
Sorry, I'm muted.
Oh,
Okay, can you hear me now? Yeah,
Yes,
the
you can.
first question is the analgesic. You see, if there are need to take analgesic, you should see a doctor. Don't just go to over the counter. These drugs are available over the counter, and that's why people have access to it, that they can take it. Let's make sure that it's doctor that prescribes it. Don't just take it on your own. It may not even be the pain. The pain that you are seeing is as a result of a sign of another disease. It may not even be just a body pain. There might be something underneath, and you are just taking analgesic on it, kill the kidney. So what I would advise is, if it's a doctor that is, see a doctor, and if you need analgesic and you have a suboptimal kidney function, doctor may be able to prescribe a particular drug for you that will not injure your kidney. Paracetamol can be taken, but also you can't take paracetamol for a longer time. If you are taking paracetamol over and over and again, it could also lead to liver, it could also damage the liver. So everything must be in moderation. So if you have a day that you just stress, you can take paracetamol. By the time you take paracetamol for 1 or 2 days and it's not going, please go and see your doctor. And even if a doctor is giving you NSAID, ibuprofen, all those NSAID, diclofenac, if a kidney patient, please don't take it. They can give you another drug that is not non-steroidal anti-inflammatory drug. So, in fact, you must see a nephrologist if you know that you have a background kidney, so that they can know the drug to give you. That's as per that. Regarding atorvastatin, if I get you right, I think you said atorvastatin, that's the drug for lipid. That cannot, there are indications to take atorvastatin, which are statin, anti-lipid drugs, when somebody have too much of fat in the body. That could not, if there is an indication for it, you can take it, but that will not replace the water. You can't just rather be taking water when you have a abnormal high lipid level, and we say you'll be taking water. So there must be a reason for that. So if there is indication for atorvastatin, you will take it. I can't remember the third question now.
Online doctors that says you should take herb, you should take ginger.
Yeah, thank you. You see, this era of social media, I think we have to be very careful. There are a lot of things on the net, on social media. I would advise that we see our doctor. Somebody will say, this thing, they don't know what exactly happened to that person. Say he took this drug and it worked for him, and you also go to take it. It may not work for you, it may even cause damage to you. So I would advise that when we have symptoms, that's why you should see a specialist. For example, now I'm a physician, but even though I'm a specialist in nephrology, in kidney management, I will not know the management of diabetes like somebody that like endocrinologist. So you must see a specialist so that they can assess you properly and manage you properly. So even if not all doctors will be able to manage kidney disease, or we know that a one drug cannot be used. So don't just take anything on the internet. Please see your doctor to assess you and see whether you need that drug or another drug.
Thank you very much for that. We are encouraged to ask our questions. And Mr. Tunde Falala, we have extended the webinar for about 20 minutes. So, sir, if you want to ask your question now, I think you were not able to ask clearly the other time. Do you want to ask now, sir? And then we have maybe after Sharifa Alao, please. Then we'll have Mr. Tunde Falala to ask the question again. Thank you. Please go ahead, Sharifa Alao. You can unmute yourself so that you can ask a question. Sharifa Alao. Please go ahead. We can't hear you.
All right. If given a doctor prescribed controlled drugs, can long use of such drug damage kidney?
I think we need more information regarding the control drug. What kind of drug? There are so many drugs that are controlled drugs. You have to be specific.
For example, eye drugs. Perhaps a drug to treat eye drop. There are some certain drug for the eye that is used to control a particular disease in case of Stevens-Johnson syndromes and the likes.
I'm listening. That question is not clear.
That's
it looks like hypothetical question. Yeah. You see, what I would say is a controlled drug. Anytime somebody prescribe a drug to you, especially if you are wary of that it could affect your kidney function or could affect induction, or you read from the leaflet that there is possibility of affecting the kidney, please speak to a nephrologist. Speak to a nephrologist. You can speak to a nephrologist. I would recommend that you speak to a nephrologist. And if it is something that you want to speak to me, there is opportunity to speak to me. So whenever you are afraid of a drug may affect your kidney function, that are used to treat something, speak to the nephrology. Many a time you can adjust the dose. That there is various ways that we could go at. If one must particularly take the drug, the dosage can be adjusted, the frequency of dosing could be adjusted.
Thank you for that. Can we have Sharifa Shorunke, please? Please ask your question.
I think somebody asked here that does low back left, is it low back pain? Can the person?
I'm trying to see if
It's Toba.
yes, please.
No, good
Please
evening.
go ahead.
Are you hearing me?
Yes,
Yes.
sir.
Okay, thank you very much, sir, for your presentation. My own is not directly question because when you mention the first thing on the way out after your presentation is through exercise. And maybe from my background, I'm a sport and exercise scientist. I'm now looking at it. Who prescribed this exercise? You are a consultant. Fine. You said they should do the exercise then. Who prescribed the exercise? They do? Hello, are you with me?
I'm with you.
Now, who prescribed this exercise?
Great. Depending on the level, whatever the assessment of that patient, depending on the assessment. For example, now, if somebody is diabetic and is overweight, in managing that kind of patient, it's going to be multidisciplinary. You will need a dietitian and you will need a physiotherapist. Even if the doctors want you to have exercise, you can be referred to a physiotherapist that will say, this is the kind of exercise that we want you to. And then the dietitian will say, we want you to lose this particular weight in over this amount of time. So it's based on the assessment that will determine the precision of the exercise. And again, I must warn us, don't let us, we must be wary, we must be careful about unaccustomed exercise. If somebody that has not been exercised before, in after the exercise you want to do 30 minutes, if you cannot cope with that kind of exercise, please don't do it. You must know what level of exercise your body can take. Like I said, normally for general population, 30 minutes of exercise 3 times a week, that is normal. But some people might need to do more than that. But we have to be wary of unaccustomed exercise that could be very, very dangerous to us, that could affect the heart. Especially if you have a heart problem, you have to be careful the kind of exercise. Let your doctor know. Don't just go and do exercise. It has to be prescribed. You have to, so you still have to speak to your doctor. If you have a heart background heart disease, your cardiologist will have to prescribe it to you. You won't just do exercise on your own. I hope I've answered that question.
Yeah, thank you, sir. Does frequent lower back pain? We have a question in the chat box which says, does frequent lower back pain, specifically left side, is that a sign of kidney disease?
If there were frequent lower back pain does not translate to kidney disease. However, when there is lower back pain, because the kidney is also located in that area, you may have to see a doctor to examine you to be sure that it's not a musculoskeletal pain. It could be musculoskeletal pain, it could be kidney itself, it could be some other thing in that place. So there are so many things that could cause low back pain. It's not just kidney. But if you have a loin pain, the pain that will be the low back pain that could be pain is the pain in the loin. The loin, that is the flank. We call it flank pain. When there is flank pain, most likely it has to do with kidney. So the back pain that is likely to be due to kidney is flank pain, not just low back pain. Low back pain could be due to so many things. It could be musculoskeletal, it could be spine, it could be anything, it could be anything. But the one specifically for kidney is flank pain.
Okay. Thank you very much, sir.
Which is just below the lower rib.
Please allow
Yes, ma'am.
Sherifat. I want to ask a question. If you
Please go
take
ahead, ma'am.
water in the morning, you take water in the morning, and after urinating, maybe frequently for about 4 or 5 times, you now feel as if something is pepper you inside your stomach. Can we stop taking the water in the morning? Or is it affecting the kidney?
Well, most time in the morning, because that's what we call insensible water loss. The water should be taken, it should be regulated over 24 hours. There is likelihood that you will urinate much in the morning because the environmental temperature is going to be relatively low at that time, and your body, essentially water loss is the water that you lose to perspiration, is going to be low, so the water will come out through the urine, so that is why you urinate more. So I would say that you take water and take it over 24 hours, not that you just take it in the morning. That is one. Two, that something is peppery. That one needs to be proved further. It is that you have a urinary tract infection, because if there is urinary tract infection, there will be urinary frequency and there will be dysuria, which is a painful urination. So that needs to be proved further. It's not that you took water alone that will make the urine to be peppery, that is being peppery or something. So if that kind of thing happens, I would suggest that you speak to a doctor
Thank you,
to further
sir.
assess if there is urinary tract infection, because urinary frequency and dysuria, that is painful micturition, might be due to UTI.
Thank you very much, sir.
Yes,
you.
I'm very grateful.
We have about 7 minutes more, so we would just like
Should we
to.
go to Tunde? I know that Tunde was waiting.
Yes, please.
Yes, thank you, doctor. My second question is this. Is there any correlation between a weak bladder and kidney disease? Because the bladder is one that collects the urine from the kidneys. And if there is any, most times they say the bladder is weak. Is there any correlation between the weakness of the bladder and kidney disease? Thank you.
Yes, thank you very much for that question. What can make the bladder to be weak, especially in, I think I will use this opportunity to speak a little bit about prostate disease. You see, all men, if we are blessed with long life, likely most of us will have enlarged prostate. As you age, your prostate enlarge. And when there is prostate enlargement, if it's not properly managed, it will lead to, because the bladder is now contracting against a, what do you call it? It's against a close, it's against an obstruction, because the prostate is between the bladder and the ureter. You remember the ureter I talked about, the pipe that takes the urine out of the body. So when it's enlarged, the urine will not be, and when the bladder is now contracting, it will go to a time, it continues contracting against an obstruction. It will get to a time that it will become flabby, it won't be able to store urine, and urine will start returning back into the ureter, into the kidney. And that's what we refer to as a obstructive bladder artery obstruction or obstructive uropathy. So it's one of bladder artery obstruction or obstructive uropathy is one of the causes of kidney disease that you see in men. Also, it could happen in female if there are malignancy involving the bladder, which could also block the bladder. It's not that the women have prostate, but if they have some other things, maybe something obstructing the bladder, a mass or something that could be obstruction of the bladder, they could also present with obstructive uropathy. So when that happens, the bladder could be weak, like you said, if I may use that word, and then lead to back pressure effect on the kidney, and the blood and the kidney now balloon out and lose all the filter, the nephron, and then develop chronic renal failure, like other causes of CKD.
Thank you very much, sir. We would like to let me just put these two questions together. We have just 2 minutes. How important is it to read and understand the leaflets that accompany our prescribed medicine? And then does the use of spices such as cloves, turmeric, black pepper, etc. have any adverse effect on renal function? So those are the 2 questions in the chat box.
Thank you so much. How is it important to read the leaflet? I think it's very important. So don't just put anything in your mouth. Don't just consume anything. Even if it's a doctor that give you, read it. And if you think, because you will know if you have a underlying medical condition that you may not be able to take this drug. At the moment you notice that, please return back to the doctor. And if the doctor, you can see a nephrologist, say, what should I take this drug? Should I not take this drug? There might be other alternatives. And if there are another alternative, there are way, like I said, we may have to adjust the dose. That's what we call renal dosing of some medication. There are cases when somebody has need to take some antibiotic, and yet this antibiotic could cause kidney, could affect the kidney function. We have to adjust the dose based on the estimated glomerular filtration. That's the renal function. Regarding the turmeric, these are seasoning and culinary substance or agent. I do not think they have any risk on the kidney.
Thank you very much for every question that you've answered and for the presentation as well. So if you have more questions, please use the community WhatsApp group to ask your question, and I'm sure Dr. Hassan would be available to help us out on that. Thank you very much, and I'll leave the floor for Alosh, please.
Just realized that I was on mute. Thank you so much for the presentation and taking all the time to answer the questions as well. So that was really, really helpful. Yes, as Dr. Alisobe has mentioned, if you have any questions, I'm sure that there'll be more. Please use the group chat, and we will endeavor to speak to put the questions to the speaker so that you can get those answers as well. So thank you so much for everyone for joining us today. So we have our webinar again this month, actually, on the 29th of April from 7 to 8 p.m. So please join us on the 29th for our next webinar. We'll have Dr. Khalid Ansari talking about sleep. I know that's a subject that has been requested by our community quite a bit. So it would be really, really interesting to have as many people as we have there. Today we have 80 people, which is absolutely incredible. So you can see how Ellipsa is growing. So thank you so much for supporting us. You are what makes Ellipsa. So please continue being part of that community. And thank you so much, everyone, for joining us today. But thank you, Marcia, for the presentation with me. And thank you so much, speaker, Dr. Hassan, for it's a great presentation and all your patience with the questions. I know we ran over a little bit. So thank you very much. See you all on the 29th.
Thank you.
Thank you. Bye-bye.
Thank you, Doctor. Thank you, Doctor. Thank you
so much.
a lot.
Thank you. It's a pleasure.
Thank you, Ellipsa.
Thank you, Ellipsa.
Thank you, everyone. Thank you.
Hello. Thank you.
Thank you, everyone.
Thank you.